So my guest today is Steve Jenkins, CEO of Positively Living, and I'm so excited to talk to you because you all are doing work right here in East Tennessee that a lot of folks don't realize is going on. It's good work, and that's helping out folks with HIV. So tell us first how you got started, because this is a calling. This is not a job you just fall into, it's a calling, and you've always worked with vulnerable populations here.
I have. I am a son of the Valley. Was born here in Knoxville, Tennessee. I have loved living here all my life. Son of a contractor and a builder, so I really thought growing up I would be into some sort of construction industry. Went to UT and got a degree in psychology, and when I got out, thought, well, there's not much you can do with the degree in psychology, and ended up working for the Helen Ross McNabb Center as a case manager. And that was really my first exposure to people that face a lot of challenges in maintaining their health. And it really opened my eyes to a whole field of nurturing, caring, not-for-profits, and the industry and the business of taking care of people in this community.
So after some time at Helen Ross, you eventually came over to Positively Living. How did that come about?
Yeah, well, I'd spent over a decade at Helen Ross, had I don't know, probably 7, 8 different jobs, had really loved it, had grown a lot there, met so many wonderful people, and a lot of those people today lead companies in this community, not-for-profits, and really learned a lot from a group of people that had the same passion and belief in the value and worth of others, and how to get there to build something that could promote that. And so in those collaborations, I just sort of grew as an individual, and then when I was at McNabb, got exposed to social work, went back to UT and got a master's in social work, and then spent some more time at McNabb, and then left around 2006, left McNabb looking for a new challenge. The job at Positively Living came open. And again, sometimes I think professions and journeys find you, and this is one that found me. I didn't really necessarily have a calling for where I ended up, but once I got here, I really fell in love with it and was energized and motivated by what could be accomplished.
What do you all do? Because the range is very broad on what you do in terms of HIV care for people here.
The vision of Positively Living today, the current version, began with a view that we can create a care model, a healthcare model that completely validates the individual, creates a safe space for medical care, and keeps you engaged in care. The thing with treating HIV is that, number one, we have to diagnose you, we have to get you into treatment, and we have to keep you on medication for your lifetime. And that's a lifetime journey, right? So you have to find a good healthcare partner to make that journey consistent. So what we found back in this has been over a decade ago, was that there was just sort of a void, and that patients were still facing stigma, even with really, really good care providers. So as we got around to the 2015 or so, we had the opportunity to sell the permanent supportive housing building. We reached out to Bruce Spangler at VMC, who I have a lot of respect for, was doing great work with Minvilla. And so we sold our property. It's now Caswell Manor. They did great things with it.
Okay.
And then that kind of got us launched into the medical space. And it really, things happen by chance sometimes. I was at a meeting of state funders, and we knew what we wanted to do. We knew we wanted to expand into medical care. And I was sitting beside the person who at that time was in charge of the state funds to help fund this type of program. And so we were talking about, at that time, East Tennessee had the lowest viral suppression rate of any region in the state. And so I reached over to her in the meeting and I said, look, I think I can help you with that. And she said, well, send me a proposal. And that was the start of it. And it really was just sort of a chance encounter to say, hey, I think we need to do something different. And that grew into, just that initial conversation, grew into the first funding for our medical clinic. And then we expanded into our pharmacy services. And it's just been a rocket ship since then.
So that really was just like the right time, right place, right seating.
Absolutely, absolutely. And finding the right person that was passionate like I was about building something different.
When you say the stigma around HIV, I think if you're not in that world, if that's not your journey, you may not understand what that truly means. What do you hear from the people, your clients and the people you all serve? What does that stigma really look like when they're trying to get care?
Wow, that's across the board. It's as simple as sort of a microaggression. The person looks at your chart and goes, oh, HIV, or more aggressive. What did you do to get this? You would be surprised at the horror stories we have heard from patients who have been judged, preached to, scolded, because of their medical condition. And the vision for us was nobody deserves that, and everybody deserves your best. And so that was really the premise of our model, from a taking care of the individual holistically, completely, and honestly.
If someone needed your services, what are they offered?
Well,
so in terms of care.
Right. So let's go back to that transition. So when we transition out of the housing, the actual supportive housing, providing housing, we moved into what now our continuum of care is medical practice, which is primary care, infectious disease care, a pharmacy. So we have several pharmacies we work with to prescribe medications through our company. We do social services, which is case management, prevention. Then we also do, we still provide about $1 million a year of housing support. So to get people in housing, to keep them in housing, to work with landlords to make sure they can maintain. So the number one predictor of someone's viral suppression is their housing status. So if you can keep someone housed, that is halfway down the journey of keeping someone healthy.
Why is that?
Well, because if you live on the street and you're transient, it's just hard to keep up with medications. It's hard to keep your doctor's appointments. People steal them, you lose them. So just not having a place to call home is very, very challenging.
Let me ask you a little bit about suppression. You talked earlier about that chance meeting and trying to get our suppression numbers down. Over the years, have you seen that?
No. Well, there's a couple answers.
Okay.
So East Tennessee has gotten better in terms of viral suppression. That number has gone up. So more people that are diagnosed with HIV and getting care are virally suppressed. We have seen the numbers go up, though. When you look at total number of cases, they continue to go up. There's about 20,000 people currently in Tennessee living with HIV, about 1,200 in Knoxville. And we see consistently about 100 new diagnoses a year in this community.
What's the hardest part of your job, of the work that you all do?
Look, I think that there's the micro answer to that and there's the macro answer to that, right? I mean, the macro answer to that is I'm a firm believer that healthy individuals make healthy communities make healthy individuals, right? I think that communities should invest in their citizens, and in return, citizens invest and represent their community. What's challenging is that as time has gone on, as you watch some of the politics of today, it gets harder to convince people that investments in community and investments in individuals is worthwhile. Mm-hmm. And I'm a firm believer it is. I think without investment in both, that you lose completely. So on a macro level, I would love to see that we have a direction where we're investing in individuals in this community and we're investing in the broader community as a whole. On a micro level, the challenges of the individual today because of the healthcare landscape to find care, stay in care, maintain care, not go broke in receiving your care, those are challenges that touch everybody, not just people that necessarily live below the poverty line. So the challenge today is to create a landscape where care is accessible, maintainable, and affordable.
So why do you do this?
Oh, look, I think because I believe in a better tomorrow. I believe in a better world. I believe in the value of people. I believe that everyone has worth. The greatest thing about this journey, when this journey really started in earnest back around 2016, the business really started growing. Not for profits or businesses, right? We have to pay our bills. We have to.
Oh yeah, we salaries.
Right, salaries. So we had a vision of let's create a really sustainable, functional, company that can be seen 20 years from now, and we can be talked about 20 years from now, and operational 20 years from now. So when we started that, there was the building of the company. We were a $300,000 company 1 year, and 3 years later we were a $10 million company. And we were in Knoxville originally. Then all of a sudden we were in Knoxville, Chattanooga, Upper Cumberland. We had a practice in Memphis. We went from 3 employees to 50. And so the great part of that was we got to experience the growing of the business, which was wonderful, right? It's a great experience to go through the process of building something that can make money, and in the case of a not-for-profit, put it right back into the community. But the other challenge was building a business of people, right? I mean, you're all of a sudden trying to convince 50 people that what you're doing is worth doing. They're valuable in it, and what you're doing for others is very, very important. And that has been the most when you said, what do I enjoy about this or why am I here? That journey has been so incredibly fulfilling.
Is there an interaction or a moment that you've ever had at work that just kind of sticks with you, whether it's with a client or maybe one of your staff that had an interaction that was just like, okay, like we accomplished that. Like this person is walking away in a better place than what they came to us.
Sometimes in this work, success is just the lack of failure, right?
Okay.
You know, so you get someone an apartment and they stay in it, right? And that's success, and that has changed someone's day and life and future. So it's the little things. I'm not sure I have a huge, just grand transformation, but it's the little moments of people finding a path that they weren't sure they had, or a direction they didn't know sure was available to them. Those are the things that I think are most fulfilling. I think the hardest thing is back when I first started in this industry. You know, it seems like this not-for-profit journey, lost a lot of people. You know, watched lots of people before medications became as available and as good as they are now, live with this and transition to another place. And that was hard. And I think it resonates today when I talk to people that are living with HIV, that look, this is manageable, right? And I want it to be manageable for you. Let's eliminate these obstacles to make it something that you can accomplish. You know, health is a journey, right? All of our health is.
For all of us, yeah.
For all of us. So, and that is our belief as a company is we're going to be a partner in your journey. Let us help you as best we can.
Do you think your clients are just astonished at the respect they get when they come? Because you want to be heard and seen. No matter who you are when you go to a doctor, you want to be seen.
Want to be seen.
And respected, no matter what your journey is. So do you all find that they're just almost like taken aback? Like, this is different over here.
Right. Well, you mentioned earlier in the interview talking about stigma. You know,
Right.
What is the impact on stigma? And that's one of the impacts is that if you have HIV or you are, you know, of a class or community and you go in and you feel the reaction of someone, you feel stigmatized, you know, that can immediately drive you away. And it is refreshing. We hear it from our patients to come to a place to where we intentionally make sure that we see you. We intentionally make sure that we hear you. And those things, you can't underestimate the value in that in creating a partnership with your clients to help promote their wellness. It has to start there, right? I mean, the number one thing that determines if someone's going to stay in care once they get there is the relationship with their provider, right? Provider being their doctor, their nurse, our provider community as a whole at Choice. So it's very important that you work hard to build that relationship and do it in a trusting manner.
What do you want the community to know about the work you do? For someone who's just not familiar with what you all are doing or the needs of your population, what do you want your neighbors, our neighbors right here in East Tennessee to know?
Well, what I would like people to know is that there's a group of really committed individuals that are helping a very, very vulnerable group of individuals who have a lot of hurdles to overcome, right? And that support can be given in lots of ways. It can be advocacy, it can be through donations, it can be through recognition that, hey, I see you as a provider doing the work. And you know, like our goal is to take our philosophy of care and broaden it. We would love for how we approach providing health care to be available to everybody, not just the HIV positive community. So we also serve the Hep C community. We also do some primary care. We provide PrEP, pre-exposure prophylaxis. So we see in our future opening our doors more broadly to allow us to serve some of the broader community with our approach.
Oh, wow. Every time I talk to someone at Positively, I always walk away with more information. I'm just like, I did not know that. And one thing I do want to talk about, and maybe it was just me, but I'm going to assume there's somebody else out there like me who didn't realize the shift in the way we talk about HIV and AIDS, and instead focusing on HIV positive or HIV non-transmittal.
Right. Yes.
Talk a little bit about that, how the shift in language.
It goes back to talking about stigma.
Okay.
Trying to reduce the stigma around living with HIV. You know, AIDS, just historically, when you go back in time, comes with a lot of some connotations that probably don't carry through to today. And so using HIV is just a more general term that carries a little less stigma.
The opioid epidemic here, we talk about it every day on the news and how bad it is. Has that really been a factor for the work that you all have to do in terms of like needle transmission and drugs? And
It has absolutely changed the landscape.
okay,
And this is a problem that was built over 15 years. It's not going to go away in 15 months, right? We are probably at the beginning of what is going to be a decades-long journey of a community of individuals that became addicted through opioids, now heroin, fentanyl, so forth. It is going to affect every layer of care, from HIV care to primary care to just mental health.
oh wow. Moving forward, what's the big picture for you all? Every time I talk to someone who's at the head of an organization, they're like, well, our big planner, this is what we'd love to see happen if money was no object. If it were up to you, where would Positively be 10 years from now, 20 years from now?
That's a great question, and we actually we spent a lot of time talking about that. The journey that we've been on since 2015 was so fast. It really was. If you had told me back in 2006 when I came on board, that I'd be sitting here with you talking about this company doing things across the state with a $15 million budget that's looking into the future of how to evolve into something bigger and grander, I would have never believed it. But I'm so happy to have the conversation, right? To be having that today, that what does our company look like and what's the next version? And I think I would say this, is that the lack of health care in communities is having an erosive effect on its community. So individuals that cannot access health care, that can't stay healthy, at some point, it not only impacts the individual, it impacts us all. And so what I would love for this company to be able to do is to open our doors more broadly, to have a greater impact on those that don't have insurance, that are living below the margins, the poverty level, that need access to really good care. And from a policy standpoint, it may be a company that can move the needle a little bit. Maybe it can encourage some Medicaid expansion in this state to give people access to health care. And you look at the community landscape in Tennessee, as we've watched rural health centers close.
Right.
We've watched urban centers have their own challenges. I'm not sure what the landscape looks like as the collective health care provider community looks like. So we have to carve out our little vision, and our vision is that we do something really specific, which is create a healthcare experience for people that are really challenged to keep in care, and we keep you there. And so I hope we can make that bigger and better.
Is it hard raising money for a nonprofit like Positively? I know all the nonprofits, that's always a struggle.
Yeah, the thing about not-for-profits, and which I fell in love with back when I was first exposed to it decades ago, was that you get to build a business, you get to employ people, you get to take care of people, and you get to do all these great things if you do it right. Mm-hmm. Mm-hmm. And part of that, doing that right, is raising money. And there are so many ways to do that. We do it through events, do it through outreach, do it through handshakes, do it through, hey, come down and see what we do. As we've grown across the state, we've got to expand that sort of outreach to our other communities. Memphis when we first started in Memphis, I'd been to Memphis before, but never realized how large it was, right? So, compared to Knoxville. So we've had a great opportunity to expand our reach there. So yeah, it's a challenge, but people, as we invite people in to see what we do, we had a donor, going back to your comment earlier, we had a donor come in a couple weeks ago, and they said, just what you said earlier, every time I talk to someone, you can see it, that they love being here. Mm-hmm. And look, if there's anything you can raise money around, it's that. And people can walk in and feel and see the passion and almost touch it. Makes it real easy.
Because employees will tell the story.
That's right. And they will tell the story.
Good
or bad, right?
That's right. I do want to end by talking about the people, the clients. I know every year you all have the Day of Hope around World AIDS, HIV Day. Talk a little bit about what you all do to reach out to them. Because you all do a lot of things that are just kind of, like you said, you're seen, you're heard, we care for you. So talk about what you do with Day of Hope. Yeah, Day of Hope is just, we do it, we recognize it on World AIDS Day. It is a chance for us to give to our community, our patient community, our client community. And we give through food baskets, we have a lunch, we give presents for them and their children, just providing some basic needs that probably they would not otherwise get throughout the year. So it's just a chance to come together,
recognize and see our patients and see some of the things that that they need through this great time. So it's just a good chance to get everyone together and have a good day of hope.
And last, do you like what you do?
Oh, I love what I do. I love what I do. I'm so glad it found me.
It found you. Thank you so much. Thank you for telling your story.
Thank you.
And thank you for what you all are doing.
Thank you.